and welcome to our video for our GCSE Psychology. This is for the OCR specification and it's a revision video for the psychological problems topic. Now in these topics, don't forget, there are 6 key areas that we need to have a look at. The first one is the key concepts area. This gives us our background to our subject and we need to sort of know how we are measuring the concepts and how they've changed over time. So it's quite a big chunk for this one in this topic. We then look at our first theory. In this topic it's our explanations of schizophrenia. Now this is set up slightly different to the other topics because we have 2 different explanations that we can have a look at. Then our first study by Daniel is having a look at dopamine and schizophrenia. So this is to support one of the explanations that we have looked at previously. Our second theory is looking at explanations of depression, and again we'll look at 2 ways that we can explain why people might develop depression. And then our second study is looking at one of those theories, so it's looking at the link between social media and how we use social media and depression. The final area we need to look at in all of our topics is the application section. Now this is really important because it gets you to start thinking about how we're going to use the knowledge that we have found. How can we use it to make people's lives better? How can we use it in modern day society? And also to then start thinking about if there's any issues with using that information. This video will focus on our first area, the key concepts, and as we said, this is quite a big area, and the first thing we'll have a look at is what we think is good mental health. So we need to find a definition of what mental health is, and then how we can define whether it's good mental health or poor mental health. Now one of the easiest ways of doing this is to think of mental health the same way that we think of our physical health. That it's a continuum, it's one long measurement, and you can move between the 2. So some days you'll wake up and you feel like you have good physical health, some days you wake up and you feel like you have poor physical health, and we need to think of mental health in the same way. So there's 2 different ways on the screen that we can think of it. The first one is an idea from Mary Jahoda. This is one that she put forward in 1958, so it's quite an old theory, and it's that to have good mental health we need to have all of these areas in our life ticked and sorted. So this is an idea that if we haven't got any of these, then we are going to have poor mental health. So for example, we need to have high self-esteem. Now this isn't overly high. If you have too high a self-esteem, if you think too much of yourself and you're too confident, then that can cause you different sorts of issues. But we need it to be high enough that we understand that we have value. We need to be going down a route of personal growth and self-actualization. Now what Mary Jahoda meant by this is that we are always trying to be the best possible person we can do. We're always trying to improve. Now that might be through education, it might be improving our moral guidance, it might be wanting to improve the society that we live in, but it's about working forward and always improving and being the best that you can be. The next point is about integration. So we have to want to be part of our society, we have to want to join in and be able to get on with other people and be able to master social events. Then Jahoda said we needed a certain level of autonomy. Now this is really important because you need to be able to manage on your own. Now that's not to say that we always like to be on our own, but this is about a case of if you find yourself on your own and you don't have anybody with you or any support with you, can you function? Can you cope? We have to have an accurate perception of reality. So do you understand that what you see around you is actually there, that you're not seeing things that aren't there, or hearing things that aren't there, and that you understand that there are certain things you can see and certain things that are imagined. And the last point was about mastery of our environment. Now this was about being able to manage on a day-to-day basis as things change around us. So for example, if you're waiting for the bus and the bus doesn't turn up, do you know what to do? If you don't know what to do, Where can you find out? Is there somewhere that you can go and get some help, or would you just be completely at odds and not be able to manage that situation at all? Now, the other explanation we've got is this mental health continuum, which is the one on the right hand side, which is a much more useful way of describing mental health. And you need to be able to perhaps compare the two. So perhaps compare this idea of Jehoda's mental health with the mental health continuum on the right hand side. Now, what this is showing us is that we can move between good mental health and poor mental health, and actually having a diagnosis doesn't mean to say you automatically have poor mental health. So for example, if you have a diagnosis of depression, but you're managing that condition really well, and actually you're functioning really well in day-to-day life, you're getting on, you're going to work every day, you're maintaining relationships, then you still have good mental health, even though you have a diagnosis. You may find that if you don't have a diagnosis, but you are not coping very well, then you can have poor mental health, and it's more a case of you can't function even if you have if you're going through a diagnosis, but at the time you haven't got one, it's too difficult for you to manage, and that means you have poor mental health. And you can move back and forwards between these two on a daily basis during the day, and there is no kind of cut-off point as to where it becomes poor. The next thing we need to consider is how common mental health problems are. So this word prevalence is talking about how common things are, so how much people suffer from them, if most people are likely to have them, or if most people are likely to have them during their lifetime. And the way that we do that is to carry out surveys at different points by different people. Now, they are very often pieces of research that are carried out by NHS trusts or universities to gather bits of information so we can see over time what's happening to mental health problems. So this was one that was done in 2014, so it's getting a little bit out of date by now, but it does give us a really good idea about how mental health problems have changed over time. And you can have a look and you can see what kind of mental health issues are most common. So as you can see from the table on the left hand side, 8.6% of the population was diagnosed with depression in that previous year, so in the year of 2013. Now that's quite high when you compare it to some of the other issues. The next one down is panic attacks, and you can see that 2.5% of the population have been diagnosed with panic attacks there. And then the other illnesses, if you have a look at them, they are slightly different types of illnesses. So if we think of things like obsessive compulsive disorder, which is known as OCD, although that's 0.8, so that's less than 1% of the population, that might be something that people are born with or has a genetic influence. So it might be that it's gained from parents or other family members you share a genetic link with. So it may not be anything that's causing that to increase. The same with phobias. That may again be something that is developed through genetic causes or is quite rare. We've also on there got post-traumatic stress disorder, which is also low compared to depression and for panic attacks. And again, that is something very specific. We see a lot of soldiers and a lot of emergency workers who would develop post-traumatic stress, as well as people who have been through other traumatic experiences like abusive relationships or very difficult social situations. But again, it's very, very rare. What we need to take from this is that there's something about those two illnesses that are really high, depression and panic attacks. And we need to think about why they might be bigger than all of the rest in 2014. And if we looked at more recent results, we'd probably find that they were still really high compared to the other mental illnesses. We can also use these surveys to see what's happening over people's lifetimes. So in terms of ages, we can have a look at what kind of mental illnesses or what kind of mental health problems are occurring over people's lifetimes. So the red line on this graph here shows us generalized anxiety disorder. So they might be things where people have anxiety about sort of social situations. We've then got the blue line which says about phobias, which is an irrational fear of something. And we've then got this greeny coloured line which shows us the prevalence of panic disorder, so it's obviously quite specific. Now we've got the ages across the bottom. What's really interesting is you can see how these change as people's lifetimes go on. So the really important one to have a look at, really, because it's got the biggest kind of change in the lifetime, is this generalised anxiety disorder. Now as you can see, it starts off higher than all the others at the 16 to 24 age group. Now that's not surprising because 16 to 24 is quite a stressful time. Most people are going through exams at that point, certainly GCSEs, possibly A-levels or other things afterwards at college or apprenticeships, and possibly even then on to university. So this is a kind of really stressful time, especially if you go to university and you move out and you have to live on your own, you move away from your family, you haven't got a lot of support. So it's not surprising to see that's quite high. What we see next then is this go up over the next few years. So if we go up from the age of 25 to 45, we can see a kind of gradual increase in the amount of people that are diagnosed with generalised anxiety disorder. Now obviously this tends to be the period in people's lives where they're working, they are probably setting up a home in terms of buying a house, getting married or moving in with somebody and having children. So this might explain why we have a bit of an increase here, because that would be quite a stressful time with people relying on you, money worries, that kind of thing. So that's all happening in those 20 years. And as you can see then, what happens next is it drops quite rapidly all the way down to 75 plus. So what we see is as people's lives are going on and then they're coming into retirement age at 65 and onwards, that anxiety disorder is dropping drastically. We also see a massive drop in phobias for people when they get to that age, and although panic disorders seem highest again when people are 16 to 24, that drops down massively as people move through their lives. So by looking at what is happening at people's various time frames in people's lives, we can perhaps get an idea of what might be causing these illnesses as well. Now obviously this doesn't tell us a lot about the exact cause, but it does tell us about correlations, so where there might be relationships between things that happen in people's lives and how they're managing their mental health. Another really important thing to consider is how we have gender differences in our mental health conditions. Now there's several reasons that we have this difference, and you need to be considering the difference between the biological makeup of men and women, but also how society treats men and women and how that can have an impact on how men or women might report their own mental health. So on the graph again you can see there is the blue line for the amount of men who are reporting these mental health problems and the orange colour bar for the amount of women. Now what you will notice is that on every single one of these there are more women that are reporting mental health problems than men. Now that's not necessarily to say that women are more at risk of developing these. What that's showing us is that more women are reporting them than men, and that fits in with how society suggests that men should deal with their mental health, in terms of it should be something that isn't really talked about, that it's a sign of weakness, and you wouldn't speak to other men about it, and probably would not be willing to go to the doctors to speak about it as well. Women are much more able to go and speak about their feelings freely, and when encouraged to go to the doctors are much more likely to do that. Men, unfortunately, even if they're encouraged to go to the doctors, are much less likely to, and that might lead to men coping with mental health problems in a different way. You see a lot of men who turn to alcohol and drugs as a kind of self-support rather than dealing with their mental health issues. So men are much more likely to be diagnosed with alcohol or drugs dependency, but it might be caused by an underlying mental health problem that hasn't been dealt with. Now, this is obviously getting a lot better. There's a lot of campaigns around at the moment that are encouraging everybody to talk about mental health, but more importantly, talking to men specifically about how it's okay to talk about mental health and to find ways to deal with their own mental health and keep themselves mentally healthy. So that's becoming much more commonplace, and it's becoming much more acceptable for men to deal with things this way now. So this leads us to a really important question of why we think mental health problems have increased over the past few years. Now, it's probably not a case of there are more people with mental health problems than there were before. The real case is probably that we are recording them better. So we actually have accurate figures of who has mental health conditions and how many people have them and what type they are. So for example, there are much more mental health problems now reported through doctors. That wouldn't have happened previously because people wouldn't have gone to doctors to talk about them. So more people are admitting that they have some problems and need some support. We've also got much better at classifying mental health conditions. So as we've seen on the previous slides, we can now split these conditions up into different types, where before it might have just been lumped under one umbrella term of mentally ill. We're much better at measuring them, and when doctors diagnose illnesses, they're very good now at recognising where the illness just needs some treatment in the community or some therapy, rather than just putting people into a mental hospital and leaving them there, as would have happened in previous generations. And that's probably because there's been some massive changes in attitude. So it's much more acceptable now to admit that you have a mental health condition and seek help in dealing with it and moving on, where before it wouldn't have been something you admitted because of the stigma and the negative viewpoints attached to it. So we can have a look then at what's happened to change these attitudes. So back in 1959, the Mental Health Act was a really important piece of legislation that was brought about by the government. And what it did is it set out clear guidelines about how to deal with people with mental health problems. And it was a massive change in how society viewed mental health conditions. So when the piece of legislation was printed, it didn't use words that had previously been common, like insane or lunatic or madness. So it was trying to move away from those stigmas. There's been lots of articles in the 1960s that was written by psychiatrists that discuss mental health problems, and that led to lots of charities being set up to help support people. The 1980s saw lots of increase of community care, so rather than just locking people away, we saw lots of projects being started to help support people in the community. And that has led to lots of famous people and positive figures talking about their own mental health conditions and changing the way that society sees them. And in particular, the World Mental Health Day, which was set up in 1992, is something that occurs every year where people can talk about their own situation and how they've made improvements. However, mental health conditions still have an impact on the individual. Society is still not quite as comfortable with mental health conditions as it is with physical health conditions, and that still causes some problems. So even before diagnosis, people are aware of negative stereotypes, and that means that sometimes people don't want to go to the doctors because they fear they're going to be labelled with this term that's going to be derogatory, that if they speak to friends about it, their friends won't want to help, they'll reject them. And even after diagnosis, it can lead to stigma. And when we talk about stigma, we're talking about these negative stereotypes that get attached to somebody. So if you are at work, if you have a job and you have to tell your employer you have a mental health condition, then people would worry that would mean that you're going to lose your job or you won't be supported. So even after a diagnosis, that can lead to rejection from society, and that obviously can encourage people to not come forward and not get help for their mental health conditions. Mental health has a massive impact on society in general. It has put a big strain on public health services. So we see lots of ambulances now going out to see patients, and their emergency isn't a physical one, it's a mental health emergency. And a lot of the hospitals don't have the capacity to deal with this many issues. You see a lot of police dealing with mental health issues, and they tend to have a lack of resources to deal with people that they have to take back to the station for their own protection, but they don't have the nurses or the doctors available to help them at the time. So there is a distinct lack of funding for our public services to deal with the issue. The law really struggles to deal with mental health conditions in the past. There have been new laws that are brought about, especially by the Human Rights Act, to protect people with disabilities and to try and ensure they have the same opportunities as other people. And also they have seen a massive increase in education provision. So there are lots of education programs now in schools and colleges that teach people about mental health conditions. Society has made massive improvements in terms of reducing the prejudice, but there are still lots of individuals that will feel anxious if there is somebody that they know with a mental health condition, and that can obviously cause conflict between people. However, there's still lots of campaigns going on, and we'll look at some more of them when we come to the application section, and we can see how famous people have got involved to try and reduce that sort of stigma. Okay, so now you need to go on to the second section where we'll have a look at some of our theories about schizophrenia.